Hi, everyone. Welcome to the Henry Schein Dental Academy webinar series. My name is Adam, Marketing Specialist, and I'll be your moderator. We are excited to welcome Dr. Bob Margeas as our speaker today, as he will review direct composite veneers. Dr. Margeas is currently an adjunct professor in the Department of Operative Dentistry at the University of Iowa. He is board certified by the American Board of Operative Dentistry, a diplomat of the American Board of Aesthetic Dentistry, and a fellow of the Academy of General Dentistry, American Society for Dental Aesthetics, and International Team of Oral Implantologists. Before we get started, we have a few reminders for you. At any point during tonight's webinar, we encourage your participation through the chat and Q&A features. Please type any questions you might have into the Q&A section of your control panel, and we will answer them live at the end of the presentation. Henry Schein is not offering CE credit for viewing or attending this presentation live or on demand. And this webinar is sponsored by Clinician's Choice and powered by Hands Online Live. Dr. Margeas, welcome and thanks for being with us today.
Thank you so much for having me. It's a pleasure to be here today. We have about 5 to 6 inches of snow. We've had to close the office early today. So it's great to be here. Hopefully I'll be able to get home tonight after this webinar. Since it's only an hour, I think I should be able to make it. So today will be a live demonstration along with a lecture. And if you have any questions at all during this program, you'll be able to type the question in, and toward the end, we'll be able to answer your questions. So thanks for taking the time to be here today, and let's get started. I work full-time in Des Moines, Iowa, and I do a lot of composite resin along with aesthetic resins, and I'd like to thank Clinician's Choice for inviting me to be able to present today. So when we think about composites and shade selection and color, you have to think of 3 things. You need to think of the hue, the value, and the chroma. And what do those mean? Because a lot of times you might do a composite resin and the shade may be right, but you think it's a little bit gray. That means the value is too low. And how can you raise value? The only way you can raise value is really through using either opaquers or dentin shades of composite. And today we're going to do a polychromatic veneer from start to finish, utilizing just 2 shades of composite, but utilizing some tints in order to bring up some of the chroma and the value for the incisal translucency. What is hue? Hue is really the color itself, the name of the color. It's a basic shade of the tooth. If I said this was A1, A2, A3, that's the shade. Or if I said it's blue, green, yellow, that would be the hue or the shade of the tooth. A1, A2, A3, that is the hue. What is value? Value is really the brightness or darkness of the color. And the only way you can tell value is through black and white photography. So one thing I like to do is if I'm trying to pick a shade, I'll put the composite color that I think is the best color to match. I put it on the tooth, I light cure it. And then what I do is I take my smartphone and take a picture with the composite cured on the tooth. I'll then turn it to black and white or monochrome, and I'll look to see if that is indeed the right value. So value is the most important of the 3 components of color. What about chroma? Well, chroma is really the degree of saturation or intensity of the color. And with chroma, the way you get chroma is you either use a darker shade of composite, or perhaps you're going to use a tint to bring that chroma or intensify that color. To make it simple, I'd like to show you a slide with 3 glasses of water. The one on the left has 4 drops of food coloring, the middle has 8, and the one on the right has 12. If I was asking you what is the hue of this colored water, you would all have to say green. That is the hue. But the one that has more food coloring in it has a higher degree or saturation of color or a higher chroma. Now, what does that do to the value? The higher the chroma, the lower the value. So if I have a dark tooth and I try to cover it with a composite, but it doesn't really block all that underlying color out, it means the value is low or the color is a little bit gray. So I don't want to really use too translucent of a tooth if I have a darker tooth. I don't want to use a translucent composite, I should say, if I have a darker tooth. The only way you can raise value, as I said, is either use a dentin shade of composite or use opaquers. The composite we're going to use today has a very, very nice opacity. So sometimes you can get away without using opaquers. Cosmetic, Renamel, the hybrids and nanos have nice opacity, as does the dentin shade of, let's say, Filtech Supreme. There are a lot of composites on the market that are good. I just happen to like the handling of the particular composites I use, that being today Veneers. And I'm going to show you exactly how we want that to be manipulated. So if we look at a tooth that's in cross section, this is what it would look like. This is from Margeas. He took this slide for me and gave it to me. If you look at the cervical, the enamel's much thinner. I like to use an enamel shade for enamel. I like to use a dentin shade for the dentin. And sometimes I'll, use a mixture or combination of both. This translucent shade on the enamel allows translucency on the incisal edge. The tooth we're going to do today has a lot of translucency, so I want to maintain that translucency. And so different composite systems require different shades of translucency or opacity. With Veneers, they have dentin shades, they have enamel shades, they have universal shades, and they also have effect shades of composite. Effect shades meaning achromatic or an enamel white or a clear translucent or an incisal translucent. If it's Filtech Supreme, perhaps it's like a WE, a clear translucent, and they use body shades versus universal shades. With Composite, it would be a body shade, or a microfill would be like an enamel shade. So if I had X-ray vision eyes and could see through the teeth, you see the translucency on the interproximal. I want you to remember this slide because the tooth we're going to try to replicate has a lot of translucency on the interproximal and the incisal. And the only way that you can create that effect is to keep the dentin away from the interproximal and the incisal. Notice the slide on the left, you see there's a lot of chroma at the tips of those developmental, the dentinal lobes. And this is, once again, this is from Margeas. He shared this slide with me. And when you demineralize all the enamel, you have a highly chromatic dentin. So I'm going to build my tooth according to the anatomy of the adjacent tooth. And if I have a lot of translucency, I want to show you how you can create those incisal effects. Because look at this tooth. If a patient came in here with a class 4 fracture, I think all of us would find this very challenging, very difficult to restore, because we need to have a translucent shade on the incisal and the interproximal. Notice the lobes of the dentinal lobes. See the chroma. The intensity of the color is greater toward the incisal edge, just little tips of color. If we look at this one, notice at the edge of the incisal and at the 3 lobes of the dentin, there's a higher degree or saturation of color. There's more chroma. And you see the interproximal and you see the incisal almost looks like a violet or a blue type incisal. I'm going to try to show you how we can create that, and along with those little wisps of enamel that look like enamel fractures. We'll put those in the tooth also. So at this first case here, this was a 19-year-old patient who went through periodontal surgery and had some formerly placed composite resins on the left lateral, the right central, and she didn't like the color. And now that they've done periodontal surgery, she wants to have those replaced, but she really couldn't afford to have all of them done. And so I'm going to keep number 9 the way that it is, or the left central. Why? Because it's in pretty good shape. So we're going to remove the old composite and do direct composite veneers. So prior to removing those composites, and I did not shorten these teeth. That's how much the tooth was fractured off. I took an impression with a material called template. Template is a fast-setting PVS, and it sets in about 30 seconds and allow me to have a matrix in order to form these thin layers. So I'm going to etch the tooth. I'm going to place my adhesive. Today, I like to scrub the adhesive with a micro brush for about 15 to 20 seconds, air thin it. And then my first layer is going to be an achromatic enamel. This happened to be like a WE, a white enamel, or a milky white material. If it's Veneers, it would be enamel white. And I'm trying to create that incisal trans and the interproximal. So when I put the dentin shade on, I want it to block the fracture line, but I want to keep it from the incisal edge and the interproximal. So you can see I've sculpted it to something that I want to resemble the adjacent teeth. Now, in order to maintain the translucency on the interproximal, I'm going to use a translucent or clear material. I light cure this first layer for about 15 to 20 seconds. I then put a translucent material on the interproximal and the incisal because I still want the color to come through that incisal edge. I'll then place an enamel layer, thinning back the enamel at the incisal edge, and then I'll put a translucent shade on the incisal edge. Once again, once I have the composite layered, I'll cure for 40 seconds. Then I'm going to start to finish and polish. I'm not going to necessarily go through the whole polishing on the first one. I want to get the primary anatomy first, and then I'll come back and I'll polish all of them together. Here we have the dentinal lobes. We've placed some translucent, the enamel shade, and then an effect shade on the incisal edge. Once again, on the other tooth, we're going to place the enamel white, place our dentin to try to replicate what we see in the adjacent teeth. Translucent shade on the interproximal. Today, what I'm going to do, instead of using the translucent shade on the interproximal, I'm going to use a tint. There's a number of ways to do it. I learned tinting from Dr. Buddy Mopper, who was an excellent cosmetic dentist until his retirement, still teaches around the country. And so here we place our enamel shade, and I'm going to place one more incisal shade at the incisal edge. So once we get done, here it is. And here it is at about 6 months later. I'll go through all the finishing and polishes step by step live so you can actually see how we do that. Now, I think we did a fairly good job of trying to replicate tooth number 9 by just doing 3 composite veneers and then just a little bit of a diastema or an incisal edge on the 2 cuspids. Very conservative for a very young patient. Before and after. And here it is at a 5-year post-op. And you can tell that the materials hold up very, very well. And you should be able to get a number of years out of your composite resins. When I do a composite resin, I expect 7 to 10 years of success on that, as long as the patients are not using their teeth as weapons. So let's go to the visualizer and go through step by step, and then we'll answer some questions that you may have if you have any questions. Okay. Now, what I've done here is I've prepared this tooth already just to save time because this is only an hour. And it's basically like a veneer preparation. This is a plastic model, so I did not take the prep subgingival. I took it right about at the gingiva. And I'm going to show you how we would create this resin veneer with all the surface texturing and also the polychromatic incisal type edge there. And so I want you to be able to follow along step by step so that you will be able to recreate this in your own office. I'll go through some of the materials that I used, and we'll talk about different materials, different instrumentation. You know, because as a speaker, do I have my opinions and biases? Yes, I do. I'm biased towards what I use in my everyday practice. And I use a lot of composite in my practice. I would say over the last couple of years, Veneers has been a big player in my practice. I like it because I like the handling. Those of you who know me know that I use Renamel microfills and the nanos. Carrari makes a very nice composite, as does Ivoclar has some nice composites. But I would say that my go-to product on a daily basis is Veneers, and one reason is because of the handling of it. And you're going to see how it handles today. So, what's the first thing that I do when I'm going to do a composite veneer after I prep it? I want to isolate the tooth, and I don't want to get adhesive on the adjacent teeth. So I'm going to put some strips in so that we can go ahead and put some adhesive on. Let me get this out a little bit. So I'm going to protect the teeth. I'm going to protect these teeth from any etch or adhesive. So we're going to pretend like we've already etched the tooth, and I'm going to go ahead and place my adhesive. The adhesive that we're using today is MPA Max. It's a 5th generation adhesive. It's meant to be used as a total etch. Another adhesive that I like here, this is from Ivoclar. It's got a nice dispensing system on it where you have a pen where you can push it down. Bisco and 3M make very, very nice adhesives. And I'm going to show you today using MPA. So I'm going to put some on my micro brush. And I'm going to scrub the preparation as I would in my practice for 15 to 20 seconds. I want to scrub it for 15 to 20 seconds if I was doing this in my practice. And you want to make sure that you get a nice hybrid layer. And then what you want to do is it's very important to evaporate the solvent. No matter if you're using a universal adhesive, a 5th generation, a 4th generation, you want to air thin it really well until you don't see any fluid movement when you do that. Now, you can see on the adjacent tooth the translucency on the edge, and you can see the color at the dental lobe and at the cervical. We have a little bit of a chroma at the cervical. So there's a number of ways to create those effects, and I'll show you how we do it. Today I'm using the Velo light. This is from Ultradent. Very, very nice light. I like the new light by Ivoclar. The technology in the Ivoclar light is very, very nice because if you ever pull it back or you're off the tooth, it will vibrate and it will add time because you're too far away. And sometimes your assistants don't keep that light necessarily on the tooth. And so I think that's some nice technology. One thing is you really need to have a good curing light. Now, in order to create that cervical color or chroma here, like we do on tooth number 9 or tooth number 2-1 for the Canadian or other numbering system, I'm going to take a tint. Now, I've put these tints out ahead of time. And if you look here, these are some of the tints that I have. Some white, some violet, honey yellow, a little mixture of brown with some honey yellow. And I keep this in a resin keeper. This resin keeper is a light box. And this is from Composite. And my assistant can have this and open it up, take it out. And I have the ability so that it won't, cure, ahead of time. Some of the instrumentation, this Composite, this is definitely the Rolls Royce of composite guns. The Composite is from Clinician's Choice, and it's easy to put the tip on like this. You put it on, it's spring loaded, you push it off. Very, very nice. It's the only composite gun that you'll probably ever need in your career. As far as instrumentation goes, I like using these Ron Jordan series REJ. This is a number 4. The thing I like about it is a very, very thin blade, easy to get into the interproximal. The other one I like is this new one from Clinician's Choice called the Ninja. The beauty of the Ninja is this. When you're doing this tooth, you have the ability, if you're placing the composite, to tap, tap, tap. And then when you want to go into the interproximal, you flip it over and it's already there, and you can thin that out without having any instrumentation in the way. I like the fact that it can get below the gum really well. Composite makes a nice composite instrument called the IPC. I like the long blade, the IPC long blade. Another one is from Ivoclar. This one is called the Optrasculpt. It's got a little pad on it, and I like that. So the first thing that I'm going to do is I'm going to take a number 3 Composite brush, which is a number 1, like this, which is a very, very thin brush. And what I want to do is take some of the honey yellow, and this are what the tints come in. This is a Creative Color Opaquer White, the old Creative Color tints. I still use these old ones because even though they expire, I think that these last a long time. And I think Composite makes the best tints. Other companies have some tints. Ivoclar makes a nice tint kit, as does Tokiyama. But I prefer this one here. So what am I going to do? I want to bring up the chroma at the cervical. So I'm going to take this tint and place some almost like at a half moon at the cervical. Now, would I do this if I didn't see this on the adjacent tooth? No. I'm trying to mimic what I see on that adjacent tooth. So I go ahead. It's sort of like a half moon. And the thing you want to remember is tints are very, very hot. You don't want too much. If you can see it a lot, you got too much. Because I just want it to be subtle. Once I get that tint on there, I'll light cure that. And then I can start my first layering of my composite. As I said, we'll be using Veneers. It's a product that I really like in my everyday practice. Why? Because it handles very, very well. It polishes nice. The effect shade, the enamel white, is really a reinforced microfill. And the reinforced microfills will polish even better than some of the nanos. You can't beat the polish of a microfill. Microfills will hold their polish, very, very well. The disadvantage of a microfill is you can't really use it on an edge because of the brittleness, but that's where you're going to use either a hybrid or a nano to reinforce that. So I put my Veneers Compule in the kit. This happens to be B1E. And what I'm going to do is I'm going to place this on the tooth, and I'm going to try to place it in one increment. You'll notice that I express it out. And what I want to do is I want to use more than I necessarily need. All right. So you can see how much I have there. And then what I'm going to do is I'm going to adapt the material using the REJ4 to the cervical, and I'm going to bring it down. I'm tapping the material. This material is very, very forgiving. It's a stiff material. I get something, bleb in there or a speck. And what I'm doing is I'm bringing this down to the incisal edge. Notice how I'm trying to adapt this first to the margin at the cervical. That's why you need a very, very thin instrument like this REJ4. And you notice that in the interproximal, there's a lot of translucency. So I've got to keep the interproximal clean. I've got to keep this area right here free of any of the chromatic shade. Why? Because I want to maintain the translucency of that adjacent tooth. If I didn't have the translucency, I would bring this material all the way out to the interproximal. Okay? So what I want to do is I want to adapt this as well as possible to the cervical, making sure that I have all my margins covered. And then I'm going to bring it down to the incisal edge and cleave it off. But you can see how the REJ can get right into the interproximal around the edge. bringing this down. And you're going to see, I'm going to overbuild this a hair, just enough so that I can polish. If you look at this, you can see I'm overbuilt a little bit, right? But I'm going to thin this out. I want you to be able to see how much more material I have. I don't want to have to add a ton of material. I want to be able to take the material away when I'm polishing this. So here's the Optrosculpt. It's a very nice instrument that you can pad the material, and you'll notice how it won't stick. It won't stick to this instrument. Very, very interesting instrument because it can smooth out and move the material. And then I can go back to my REJ and do this, cleave it off. Why? Because I want that translucency on the incisal edge, correct? If I didn't have translucency on the edge here, then you know what I would do? I would take it all the way down to the incisal. So now I want to be able to create those dentinal lobes. So I'm actually splitting the material, keeping it short of the incisal, trying to determine how much material you need. If you look at this, you can see I'm a little bit over contoured, not bad, but I've got to try to create these developmental lobes similar to what I see on the adjacent teeth. So I can split those up, right? And I want to maintain the translucency. You can see on the edge now, I've got and the one thing you remember is the lobes are not even. One can come out higher toward the surface than the other one. So maybe this distal one comes out, higher to the surface, and we can split that up to create what? The effect of the translucency of the adjacent tooth. Okay, so I have to look at the adjacent tooth and determine, okay, what do I see here? Do I see this trans? If I didn't see this trans, what would I do? I would bring that material all the way down to the edge. But I want to try to keep that out of there. So the other thing that I do is there's a couple materials you can use to move composite. One is called resin blend, low viscosity. The other one is called Brush and Sculpt. This is from Cosmonite. This is a 36% filled. This one is not. And so it's just a matter of preference on which one you want to use. I'm going to put a little bit just on my glove. And then what I do is I take my brush, and what I want to do is just prime my brush. I just want to put a little bit on my brush, prime it, and then wipe it. And then what I'm going to do is I can move the material like this. I mean, I would say, this material handles as good as any material on the market. I've always enjoyed the handling of like Filtech Supreme. I like the Renamel Microfill and so forth. So you kind of see I've got those, the lobes the way that I want it. And I'm going to light cure that. And so really what gave me this design was the adjacent tooth. If you don't have all the translucency, then you don't need to inner sculpt it like that. But with the other tooth like that, I can see that you definitely needed to add some trans to that. So once I have that, then I'm going to go back and I want to maintain the translucency. So what I'm going to do is I'm going to take now a little bit of violet, of the creative color violet. And what I'm going to do is I'm going to take that, I'm going to place that into, I'll show you here in a second, into the incisal edge and the interproximal. As I said, these tints are hot. So you see how much I have on here? I don't have a ton, but I'm going to just lightly put some here. I'm going to put some here. I don't need a lot because this is going to shine through, because I'm going to then use an achromatic enamel shade. So if you didn't have all this trans, you may not put that violet between there, okay? And now I'm going to light cure that. Now, the other way of doing that is I could have taken an achromatic shade of Evanescence, like the clear translucent, and filled that in, but I chose to use tinting instead. Now, how do I get the chroma at the tips of the dentinal lobes? Well, what I like to do is this. I'll take a mixture. This is a mixture of the honey yellow brown and light brown of the creative color. And what I'm going to do is I'm going to watch how I can touch the tips of this here. 1, 2. And you can see how that can start to shine through, and it will give it some depth. Notice the violet there? It's going to give it some depth once I place my enamel white. So I'm going to place a little bit more here. You don't want a lot. A little goes a long way. If you can see it like that, you almost have too much. So I'm going to light cure that. Now, in order to create some of those striations, or the like the dentinal fingers or the enamel, like white areas that go to the tips, I'm going to show you what I do is this. I'll take some of the white creative color, and I'll put this right here, here, and here, like a little dot. And then what I want to do is I want to drag this. I want to drag this toward those lobes like this with the light brushing stroke. You can see it over here, a little bit of white there. So I want to try to copy what I see. So a little bit there. So you can kind of see what we're talking about. All right. So now I want to do my final interproximal. This is where I'm going to use an achromatic shade of Composite. I'm going to use the enamel white. If it was Filtech Supreme, it would be like a WE. If it was Renamel, it might be like a milky white occlusal. And what I'm going to do is I'm going to put my strips back in. I want to put my strips back in. And I'll show you what I'm going to do. I want to put the strip in. Then I'm going to put the strip on the other side. You really want to make sure that you get the strip between the tooth and the gum. Let me center this here in a second. I got to get this strip in here, and then I'll show you what I got. Hard to keep that there like that without. Once I get it in here, I'll center that so you can see. Because it's really critical to get under the gum. And with these plastic models, sometimes it's a little bit harder to get the strip under the gum. So now, so what I want to do here now is use a composite shade that is called enamel white. This is an achromatic shade. And I'm going to place that in the interproximal and on the incisal. So I'm going to lay this here. And place that material like that. You can see from the incisal, I have that material here. And then what I want to do is move it up, force it. I'm trying to force it between the lobes and into the body of the tooth. I don't know where this stops. I'll show you once we add it and we do our pull through, but it may go halfway up, it may go a third up. And what I like to do is cleave this off. The beauty of this material is it really comes off easy. And now I want to show you my first pull through technique, right? So now you see the material here, it's against that strip. What I do is here, I take my finger, I push, and then I lightly just pull this through. I want to drag the material here because I'm not using a wedge. And you notice how that just comes through on that interproximal. And then I'm going to take my instrument and I'll clean this off. And then I'll go to the next side like this. I'll hold my material here against my finger. I'm forming it and then pull it through. And it will go through like that. And then what do I have to do? Got to tuck this in. Got to tuck it in. Blend this up. And get the basic shape of the tooth. I want to start, I want more. I want it thicker than the adjacent tooth so that when I finish and polish, I'll have the right thickness. But the thing I like about Veneers is just the handling of the material. The shades are great, but the handling really, to me, is critical. Other materials on the market, I like the handling. I like Filtech Supreme. I like the Renamel microfills. Carrari makes a nice material, and the new one from Ivoclar. So you have to see what you like if you're a sculptor or a painter. And once again, what am I going to do? I'm going to blend this in, and this brush with the brush and sculpt or the resin blend allows you the ability to move the material quite nicely, like a ceramist would, when they're doing their work. So I'll use the resin blend or the brush and sculpt, and I'll move the material where I want it, and then I'll cleave off any margins I might see. If I see something that doesn't blend up here, what I'm doing is I'm making it, thinning it out, and then I'll cleave it off because I don't want to have any ledges. The beauty of the REJ is it's so thin. This and the composite instruments from Composite, very, very nice instruments. This is the Ninja. The beauty of the Ninja is look how thin this is, and it's sharp. I can cut the material because I don't want to see where there's a margin. I don't want to have to finish a ton, right? Because if you have material that you have to finish, you're going to see a white line, or you're going to have an edge where the composite is. So I take my time, and you notice when I did the pull through, I've got a contact there. You can see it's just a little bit thicker than the adjacent tooth. And I do that on purpose because I need to have some room for finishing and polishing. So the material cleaves off. Once again, I want to show you what that looks like. I'll have the ability to finish a little bit of that, and then allow the color to come through. So as I'm doing this, if I was doing this on a patient, it's exactly the way I do it. I use my brushes, blend the material. And I want to make sure that I don't have any white lines, you know, or no lines that I can't finish really well. So I'm going to cleave this off the edge. And then we'll start to finish and polish it. I don't want to have a ton of excess, okay? I don't mind a little bit, but I don't want a bunch, because then I have a lot more finishing to do. I'd rather spend my time layering it so that I don't have a lot of finishing. Here it is from the incisal. You can see we have just a little bit, and I'm going to go ahead and light cure it. So had I gotten etch on the adjacent teeth and adhesive on the adjacent teeth, there's going to be a big problem. It's going to bond. It's not going to stick. It's going to bond to it. So I want to make sure that I have a really, you know, good isolation with the strip and the adhesive. I don't want etch on the teeth. So let me show you how we start our finishing and polishing. I'll use discs to do finishing and polishing. Marcos Vargas and myself, we just did an article on the 10 steps on going to be in the Journal of Aesthetic and Restorative Dentistry on where we're starting. You know, you always want to start with the incisal edge to shorten the incisal edge, facial incisal line angle, the line angles, the dentinal lobes, the depressions. Goes through all of that. So now I'm ready to finish and polish. You can see it's sticking out a little bit, but that's okay. Why? Because I have the ability now to use my discs and polish it. So I'm going to start with this is a contour disc. This is from Clinician's Choice. Cosmodent makes some very, very nice discs, the Flexi discs, and 3M has some soft flex discs. So what I'm going to do is I'm going to do the incisal edge first. I'll start with the incisal edge, okay? Making sure that we get that the same height. Now, the next thing that I want to do is I want to get the incisal edge back. So I'm going to use my disc here like this, bringing this back. And I go from the cervical to the incisal using my contour disc. That's the name of this. And I'm going to switch to a smaller disc, but you're going to start to see that I can bring this back. I don't want to take the disc and just work it across the tooth. I want to take the disc and work it on the interproximal. A lot of people have never used discs. I could not work without discs. Okay. You can start to see that as I'm bringing this back into the arch alignment, But I'm not making the tooth flat. I'm trying to do it in 3 planes. where we have a cervical, a middle, and an incisal. Very similar to what you see here. See how I have that in alignment? Now what I'm going to do is I'm going to go to the smaller contours because I like to get this into the interproximal. Like this. I'm going to take this disc and I'm going to go into the interproximal and I'm going to narrow this. Thin that out. And then I can come over here, thin this out a little bit because sometimes people have a tendency to make the teeth fat because they bring the line angles too far out to the interproximal. I want these line angles to be, I want the line angles to be in the right spot. Okay, once I have my primary anatomy, I'm going to go for the secondary and the tertiary anatomy. So you can see I've got that pretty much maybe a little bit sticking out too far. So I'm going to cut it back just a little bit more. And I'm going to do that too with my diamond burr. Okay. So now we've got my diamond burr that I want to use. This is an this is a Brasseler fine diamond, F888012. And what I'm going to do is I'm going to use this to create my developmental depressions. There's a mesial and a distal. And this is what gives the tooth the ability to look like a tooth. Usually it's deeper toward the incisal. So I'm going to start to continue to make this depression here. This is a Veneer electric handpiece. Love Veneer. Been with them for 25 years. I've used their product. Now, sometimes you'll see, like we see in the adjacent tooth, a depression on the interproximal and a depression like in the center of the tooth. You can see here, I've got my 3 lobes, and I'm going to get the depression here in the center also. So a lot of times what I'll do here is this. I'll continue on and then I'll split this a little bit like this. Like that. And you'll start to see the anatomy of the tooth. Then what I'll do is continue this here. And then in order to create the paracomata or the lines you see here, I draw this like this. Okay, like that, with the powder and everything. And then you'll start to see the tooth take shape. All right. Now, once I have that, what I want to do is do some imbrication lines across the tooth like this. I'll take this burr here and I'll draw this like this. There's usually 3. Like that. And then what I can do is I can chatter this on the tooth. Like that. To get the enamel stippling. Then what I like to do is I like to use an ASAP or an ASCP daily. This would be the ASAP daily. It's like a polyurethane. And it will I'll polish it a little bit like this. Make it softer like that. And then I'm going to go to my groovy polisher. This is a groovy diamond polisher like this. So you can start to see the shine and the surface texturing. And if you want more surface texture, you would go back and you would go ahead and use the diamonds. Now, the final polish that I use is what's called Enamelize on a Flexi Buff. Enamelize is a composite polishing paste. And you put a little bit on the tooth like this, and you're going to really see a high shine of this Evanescence. This is the Flexi Buff. It's a felt wheel. This is from Composite, the only place you can get it. Composite's direct company. And then you flex it like this. And there you have a really, really high shine. Let me get the paste off here. We have the translucency and the surface texture. That's how you create the translucency that you want and the polishability and the shine. You can see it. It's almost like a 3-dimension. It comes out through at the incisal edge. So if there's any questions that you may have, I'm happy to try to answer some of those questions.
Great, thank you. We've got lots of questions. I'll kind of start from the beginning, so apologies if we backtrack slightly. The first question that came in was, what matrix bands do you use to create your interproximal contours?
I don't use matrix bands for my interproximal. I use the Mylar strip as a pull-through. The only time I'll use a matrix band would be the BioClear system if I have black triangles. But if I have a class 4 or direct veneer, I only use the strip as a tool.
When I see composite veneers to close a diastema, there's always gingival inflammation between the two. Any recommendations on how to safely close these without inducing inflammation?
Yeah, you have to be very, very careful. So it's a freehand technique. I teach that on Hands Online Live, the diastema closure. I never end up with any ledges. If you do it freehand, do the facial wall first, light cure, and then come back and do a pull through on that facial cured wall, you won't end up with any type of ledge or inflammation. You ought to be able to floss perfectly. One thing I do want to say is, if you have a ledge or anything, I like using these Epitex strips. Epitex is from GC, and when you do these strips, you go like this. You do it in an S curve, not a C, an S. If you have any overhang or polish, you just use that Epitex strip.
All right, while we're talking about strips, there was one question that asked, do you recommend using a wedge for the strips?
No, I do not use any wedges at all. Wedges cause bleeding in black triangles. You just don't need to do that. I can sometimes torque the tooth and use a strip. The flexi strips from Composite are nice strips also. They're pretty thin.
All right. How do you control the bleeding from the gum?
If there's any bleeding, I don't. If a patient comes in for a consult and I'm going to do bonding, if there's any bleeding, I don't schedule the patient. If I have to, I'm going to pack cord. I'll either use Siltrax cord from Pascal, or I'm going to use the Ultradent Ultra Pack cord. Do a 000, and then I'll use the I'll either use the gooseberry material from Clinician's Choice, or I'll use Ultradense Clear, Viscostat Clear.
How do you manipulate composite cervically in cases where there is marginal inflammation due to patients' lack of oral hygiene or previous poor restoration?
If they have inflammation and stuff, I do not schedule the patient. I don't want to have any type of problem with bleeding and stuff. So to me, I'm very concerned about that. I'm very concerned about bleeding, and so I don't want to have that. So I just make sure the tissue is good. If the tissue is not good, I'm not going to schedule the patient.
How do you guarantee that the composite won't stick to the adjacent tooth when you pull out the mylar strip and continue working without it in place?
You know what? It does stick, but it won't. It will stick, but it won't bond. Okay. I want it to stick, and then I'll torque that. I'll torque it, and I'll separate it. If you got etch and adhesive on there, it will bond. I just want it to stick. This is one of the courses that we're offering, for Hands Online Live. If you want to learn how to do diastamal closure, even do a class 4 along with me, there's a promotional code, 15% off. I just wanted to let you know that.
No problem. We got a couple of questions about brushes. The first one is, how do you clean the brushes between patients? And I guess part 2, how do you sterilize the brush?
Yeah, you really can't autoclave the brushes. I use like Cavicide or the Cavi wipes, wipe them, and then I'll put them in Cavicide liquid. We're trying to come up with a brush where we have the handle with disposable tips, but that's in the works right now. But you really can't. The only way you can do it is cold sterilization. Can't autoclave them.
How long do you cure the final layer of composite?
I cure my final layer for about 40 seconds.
Do you select the shade before application of the rubber dam?
Yes, always, because the rubber dam, the teeth will be dehydrated, and you're never going to be able to match that. So it's really important to choose the shade ahead of time. And I put the composite on light cure, and then I'll take a picture, snap a picture, black and white, turn it to monochrome to tell the value of the tooth.
And you may have touched on this already, but what brand or type of flowable composite do you use in your office?
Oh, I use Evanesce flowable. I'll use the Renamel microfill flowable, and I love the Carrari flowables. The aesthetic flow. It's really a very, very nice material. But there's a lot of them. Even 3M has a new one on the market that I've used all those brands.
Do you use water when polishing or adjusting with the diamond burr?
I do not. I do it dry and with air, and then you saw I was wiping it off with a wet gauze. I wipe it off after I dry as it's dry, because I like to see the powder where I'm doing. If I'm doing it wet, I have a hard time seeing the anatomy.
If you're working on a child or a patient that's slightly wiggly, what steps are critical, or is there anything that you can skip?
No, everything is really critical, and isolation is the most important. If I can put a rubber dam on, I'm going to put a rubber dam on. I'm going to try to work as fast as possible, because when you have a small child, I mean, you can only do so much, and sometimes it's not as good as what you could do. That's why I never criticize anybody's work, because you don't know the environment they worked on, but you really have to work fast and be efficient. I schedule 45 minutes for a direct composite veneer from start to finish.
Do you ever heat up the composite?
I heat up composite only when I'm using the BioClear technique that David Clark developed. A very great technique for when you have black triangles. And I do heat my composite when I'm using the BioClear system just for closing black triangles. There are advantages to heating up your composite. It helps the properties. I just don't do it on a regular basis.
How do you distribute space evenly when veneering anterior teeth with spacing?
I use what's called the Erskine dental caliper. Erskine dental, they're digital and they have a digital printout. If I'm working with an orthodontist, I tell the orthodontist exactly where I want the teeth to be, so that we know exactly where they're going to be. But it's a caliper that's digital, has long points to it that will really give you the ability to um, know the exact width. So I use those calipers.
How do you blend class 3 or 4 without showing a line?
The only way you can do that is you have to take the hands-on line live course. Just kidding. Um, I blend it in by doing a long bevel. Doing a long bevel will help you hide any fracture line. If I'm doing a class through 3 and through a class 3, I'm going to bevel the facial and I'm going to use dent and shade on the lingual. I'm going to put the composite enamel on the facial. I'm going to do a pull-through technique like you saw here. I'll be honest with you, the hands-on line live courses go through very thoroughly, whether it's me or Vargas or Chan or Geisberg. I mean, it is a very, very thorough course showing live how to do it and discusses all those. Vargas does class 3s and peg laterals. I'd highly recommend it. Newton Fall does it. There's a lot of course that you can check online.
How do you avoid voids within composites?
Great question. Sometimes it's inherent in the composite. I find that Evanesce has very few bubbles, but I do get voids. Did you notice when I was expressing that out? I don't want to fold it on itself. I want to try to pat it, and express more than I need. Because if I have to keep on adding, that's when you can get voids. That's when you get bubbles.
Can you remind us what the name of the round flat-sided instrument was?
That was called an Optrosculpt. It's an Optrosculpt pad from Ivoclar. Very, very nice instrument for composites when you're trying to move the composite.
When would you use Teflon tape as opposed to Mylar strips?
I would only use Teflon tape to protect the teeth from etch. I want to use the Mylar strip as a pull through against the natural tooth, as long as I didn't get etch or adhesive on it. I won't, as long as if I'm doing multiple teeth, once I get the first central done, I really make sure I polish the interproximal well so that the second composite will stick, but it won't bond. But if it's not highly polished, you could use Teflon tape there, but I don't necessarily like that for that technique.
What do you mean by torque the tooth when you have composite that has gotten stuck on the adjacent tooth?
When you have a composite that's gotten stuck, I'm going to use like a thick IPC instrument, and I'm going to go up toward the gum line, and I'm just going to torque it. I'm going to put it between the teeth and twist it. And if I didn't get adhesive with etch on it, it will just torque. It'll come apart. It'll break apart. Then I can use a strip in the between using an instrument. I'll use a thicker instrument, go up toward the gum line and torque them, twist that apart, those teeth.
How deep do you place your margin on anteriors, and how do you stop the finish line being seen?
On my anteriors, if I have a dark tooth, I'm going subgingival or equigingival. If I have a nice shaded tooth, I may stop it, super gingival a little bit. It depends on each case, but normally I like to keep my margin either equigingival or slightly subgingival, packing quarter rubber dam, so that you never see that margin. On a class 4, I don't take it below the gum. I bevel 2 millimeters past the fracture line, and then I blend it into the tooth.
If a composite veneer edge fractures several years later, do you repair it or make a new veneer?
That's a great question. A lot of times you have to take the whole thing off, or you have to prep down to good tooth structure and then try to repair it. You have some unreacted monomer on all composites. They don't cure to 100%. So sometimes, depending how long it's been in the mouth, you can get lucky. But if I'm going to repair a fracture, let's say I repair it, I'm going to prep it back, and then I'm going to sandblast it. I'm going to use the Prep Start from Danville Engineering, and I'm going to prep that back. And then what I'm going to do is add to it. I'm going to just place adhesive, and hopefully it'll hold. If not, I'm going to have to take the whole thing off.
What impression do you use for the posterior initial step?
For the initial step for a posterior, what impression?
Yes.
I I mean, the only impression material I use for stents or stuff is template from Clinician's Choice. I don't really understand the question that well. If I'm doing posterior, I'm gonna prep the teeth, and I'll use sectional matrices like Dual Force or Garrison 3Ds. But I don't really understand the question.
Let's try another one. A little over, so we're going to do lightning round here. Please explain the technique to avoid the white line again.
Oh, for white lines, you got to make sure you do a long bevel. Make sure that when you're taking the composite, you're honing it, going from the composite to the tooth, and you're making it as thin as possible. And never go to the next disc. I use discs. Discs will keep you from getting white lines, and I'll use the coarsest one, then the next coarsest, and I won't go to the next disc until the white line is gone. You can't go on. If you go to the next disc, it's just going to come up on you for a white line.
Which brand of composite brushes do you prefer?
Composite. And there's another one I like too from Estheticon. Carlos Sanchez did that. It's called Estheticon, AES Estheticon. It's a nice brush, got different tips to it. But I use mainly the Composite number 1 and number 3 brush.
You mentioned ASAP and ASAP dailies. What's the difference?
The ASAP dailies are meant to be used like on a daily basis. You could use them 4 or 5 times and throw them away. You autoclave them, but they're meant to be used daily. The other ones, the ASAPs, can be autoclaved 20 to 25 times. The other ones like the Brasseler, Diacomp Featherlights, very similar. You can autoclave those too. So the dailies are meant to be used 4 or 5 times just on a daily if you're doing a lot of composites, and then you can just throw them away.
How do you prevent polymerization, shrinkage, or a white line near the gingival margin?
I mean, you got to make sure that you have your margin really, really good. As far as sometimes it can pull away from the class 5 if you're not careful. Using a good adhesive will help. But I'm just very, very careful when I'm placing my composite and avoiding pullback. I think for class 5s, the Optrosculpt works fairly well to pat it down so you're not pulling it off. And then I'll use even carbides around the gum line to get rid of any lines.
Do these composites stain?
Some composites will stain. My experience with Renamel over the years and Filtech and Evanes, if you're using adhesive on your brushes and not brush and sculpt or resin blend, the HEMA in the adhesive, if you put it on the instrument or the brushes, can become incorporated in your composite. It can yellow over time. I find with a high polish, you should not get any stain. I have 25 and 30-year follow-ups with Renamel microfill with very little staining, if at all.
If the color is off, what's the time frame you have to have the patient return to correct the color without removing the entire restoration?
I try to have them back within a week or so to just take that, because that can happen. I've done it, and because you don't want to stop in the middle, and I'll have them back and I'll resurface it. I'll go up to a week or 2, no problem.
Expected longevity, what do you tell your patients?
7 to 10 years, as long as they're not biting their fingernails or using their teeth as weapons.
If we cut back some composite layer, do we etch and bond again before doing the next layer?
Yeah, I etch it just to clean it. It really won't do anything. I like to, if I'm doing it on the day, what I do is I cut it back, etch it, rinse it, and then I use only unfilled resin. I'll use unfilled resin like a DE resin from Composite, Dentin Enamel Bond, or Bisco has an unfilled resin. I don't want to use a primer if I'm adding between layers, and I do not light cure that between the layers.
All right, we'll make this the last question tonight. Do you ever place a protective resin coating on the finished surface of the restoration?
I never used like a Fortify or a Discover. I want to get a high shine, and going through the system that I use, showing the discs, the groovy diamond polishers, and the enamel eyes on a flexi buff. The surface sealer will give you a high shine, but it won't last more than a year or 2. So I do not like surface sealers, and I can't get the surface texture the way I want it.
Great. Well, thank you very much, Dr. Margeas, for your time today and for answering all 41 of those questions. If anyone does have additional questions about tonight's topic, please feel free to email us at webinars@henryschein.com. Additionally, if you are interested in attending future Henry Schein webinars, Visit henryscheindental.com/webinars for our upcoming schedule. As a thank you for attending tonight, everyone will receive the recording of this webinar via email later this week. Thank you all for joining us, and we hope to see you again soon.